But in the beginning, they were $300 a prescription.
Lois Cooper says a private for-profit surgery clinic in Ontario cost her plenty, including her trust.
I wouldn't have ever spoken out if I hadn't heard Premier Ford say that these private clinics won't charge you money, won't charge extra. It feels like it's my public duty to say that's not true.
In 2016, Cooper had a macular hole in her right eye, causing a dark spot at the center of her vision. Within weeks, she saw an ophthalmologist. Cooper says she had vitrectomy surgery in a warehouse-like clinic and went home with bills.
I've been sent there by my medical professionals. So that would mean to me that this is where you should be and this is how it's done.
Cooper's vitrectomy surgery was medically necessary, which the province pays for. But before that surgery happened, she was upsold and asked to sign off on optional tests, services, and procedures. She says the surgeon later recommended equipment, referrals, and a treatment for eye floaters that failed. Then Cooper says he told her there was a mass in her other eye requiring more surgery. That's when she started asking questions.
Where is it in the eye? What layer is it in? Where is it? And he just looked at me and he said, "You can leave." And then he turned to his assistant and he said to her, he said, "Charge this appointment to OHIP." So I didn't have to pay for that appointment, but I had to pay for all the rest.
Cooper says she then went to another surgeon who told her there was no mass in her eye.
You don't have 10 years of medical training under your belt. So you're at a huge disadvantage when you're presented with information.
Data shows private for-profit clinics are overbilling and upselling Canadians for hundreds of millions of dollars.
We need to be concerned about upselling because it's the thin edge of the wedge towards extra billing, where patients are told they can only get something that's publicly covered if they pay out of pocket.
I just want people to be aware that when they go to a private clinic, make sure you ask questions, don't sign any papers, go there first and get all the information on what they're going to want from you, and then maybe go talk to somebody else.
Cooper says her vision is fine now. She can't figure out what purpose another surgery would have served, except profit.
So, Christine, we know this happens outside Ontario too, BC, Quebec, for example. So how does someone protect themselves when they're going to a private clinic for something that is medically necessary?
No matter where you live in this country, it is illegal to be charged a fee for a medically necessary appointment, procedure, or surgery. We've already paid for this. Dr. Raza said if you find yourself in a clinic and you're being asked to pay fees, ask the question, do I need to pay this fee in order to get the care? Read documents you're given. If things are optional, it means you don't need them. There's such a power imbalance in these situations, and that's why provinces are supposed to be policing clinics that are upselling and extra billing people. They don't make healthcare better, just more expensive.
Christine Barak, thank you.
You're welcome.